My name's Dr. John Lieurance, and I'd like to talk to you about an exciting new therapy called PRP therapy, or Platelet Rich Plasma Therapy. Normally, when you have an injury, what your body will do is it will seal the area that was torn and damaged with a matrix of undifferentiated cells. What the platelets provide, if you look at the following slide, as shown on your screen here, these discs, and if you look at the discs very carefully, you'll see growth factors, or those dots that are covered around the platelets. And those are very important because that has a big role in your body's ability to heal itself, both the platelets themselves and the growth factors. And typically about 60 cc's of blood would be extracted from the patient, and the blood is actually put into a machine called a centrifuge. And what the centrifuge will do is it'll actually spin the blood, and it goes through a couple of cycles where it spins it one way and it spins it the other way. And there's a special apparatus, and this apparatus is specific to collect the platelets. The end product of this processing is a small amount of platelet-rich plasma, which is then utilized for the procedure. The platelets are then injected into sites of damage or degeneration, such as into a joint, a tendon, or a ligament. And this is just illustrating what it might look like inside of a knee or a shoulder or an ankle or a finger, whatever joint you're talking about, where these areas of damage are the areas that the platelets will adhere to form a graft. A number of sports figures who have had the treatment done, and a number of leading orthopedic specialists who have chosen to introduce this into their practice. One of the most famous is Hines Ward, who became MVP of the Super Bowl. There was a lot of press and media that talked about how it was questionable whether he was going to play in the game due to a knee strain, significant knee strain, and the team orthopedic did platelet-rich plasma on his knee, and 2 weeks later he was ready to play and did quite well in that game, if many people recall. Another well-known figure that was involved with the Super Bowl and was not scheduled to actually play until he had platelet-rich plasma therapy on his knee injury was Mark Pulumawa, and as you can see, he did great. So, with regards to the platelets will accumulate in an area, and once they've sealed that area, those platelets are then eventually replaced by stem cells that then differentiate into whatever tissues are necessary for the area, whether it's cartilage, ligament, tendon, or even bone. What's so great about this procedure is this is exactly the way your body normally heals and repairs itself. But oftentimes it doesn't, because the tissues that we're talking about here, cartilage, ligament, and tendons, often don't have the blood supply in order to draw these platelets into the areas. I see platelet-rich plasma therapy as being on the cutting edge of non-surgical orthopedic medicine, and we're excited to have platelet-rich plasma therapy here at Advanced Wellness Center, and we're seeing some very exciting results on our patient. I invite you to come and explore how platelet-rich plasma therapy might be of benefit to you. Thank you. To find out if you're a candidate for platelet-rich plasma, please call our office to set up a free consultation or check us out on the web.